Chapter 17, Legal Reporting Requirements. This is a nice short little chapter and PowerPoint. Legal reporting requirements are for many, many healthcare facilities, and different states have similar laws, same laws, different statutes, different regulations, but across the nation, most of these are expected. Learning objectives are on page 341 on the book and on this PowerPoint slide. Abuse in the healthcare setting, it can take many forms. It's definitely not easy to identify every time, but sometimes it's very blatantly clear, and we all have a due diligence as humans, much less as healthcare employees. You have to report. So back on page 341, this chapter provides an overview of a variety legal reporting requirements mandated by both federal and state regulatory agencies. So, abuse is defined in our book. Abuse in the healthcare setting is often seen to those who are most vulnerable and dependent on others. So, you automatically think of little babies, small children, adolescents, and then on the opposite end of that spectrum, we have the elder population who they're depending on a family member or a neighbor or nursing assistant or someone to provide their care, and they are just at risk. They're at risk for financial abuse, stealing money. Family members will do that. Healthcare givers will do that. Um, so that's where we're talking. That's what we're talking about in this chapter. Child abuse is it's written about on page 342. You'll read about that. Who should report? You will have, as a healthcare facility, whether you are the employee, the administrator, CEO, there are laws and penalties if there is a failure to report. So you have to report. It describes how to detect good faith reporting that is mentioned. I will tell you, in real life instances, you are not alone in this decision making process to report. You will grab your supervisor, you will grab someone who's maybe been through this before, but you do have to report. We have to. Here's a definition of child abuse on the slide. Detecting it. Now, let me say this. Young children often have bruises naturally. Burns are rare, that they do occur, but most of the time you're going to see child with lots of bruises. That's just from running, playing, being a kid. So please don't automatically think that a bruise is abuse. And burns are accidents. They do happen. They're not as natural as bruises. And the same thing with broken bones. Broken bones are they're not normal, natural either, and they're rare too. So these are probably two of the biggest signs to look for. But don't let bruises unless they're very, very bad. Now, the little bruises I'm referring to that are normal are where they fall, playing, running, jumping. Those are normal bruising, but deep, dark, multiple bruises, you're going to have to ask questions. And you have the right to. Actually, you have the duty to. Behavioral indicators also can help identify child abuse. Good faith reporting, you have to have reasonable calls that the injuries are not accidental. So if the child can tell you, or if the elder person can tell you, then that's your reason to believe it's not accidental. If, like I said, you have those deep, dark, multiple bruises, that's probably not accidental. But those little light bruises that a lot of toddlers have. Um, here's a difference. A 2-year-old can have those little bruises I'm referring to, but a 7-year-old shouldn't have that as much because they're not learning how to walk. They're not running and jumping, and as much as a 2-year-old will. The 7-year-old can be a little more careful and have a judge of gravity and a judge of distance and such as that. Okay, failure to report child abuse. So we were just talking about that. You have to, you have to. Um, every, even as a nursing assistant, a janitor, the CEO, or a passerby, you have to report it. You have to. Okay, unexplained, unexpected death. This is a list of elder abuse and the signs. So we just quickly went over in the chapter 344. Be sure and read the court cases on page 343 and 344. Right before we get into elder abuse, the reality check on page 344 and 345, biggest thing about this is the oh, I don't know if this was a nurse or who wrote this, but an uneasy feeling. So yes, believe it or not, you can use your gut feeling when you are in a situation. If your gut is telling you there's something wrong, listen to your gut. If you have seen something and you've asked your questions and you've done your due diligence and your gut feeling says, okay, that's okay too. But again, in real life situations, you're going to grab a supervisor, you're going to grab a peer. It's always good, especially liability wise, to document that you had, second opinion, etc. But that uneasy feeling, that is just a natural thing we have. You need to listen to it. Okay, moving on. Elder abuse. Here's the slide. It's on page 345 and 346. Then we get into documenting abuse. Yes, caregiver record the symptoms, witnesses, photographs. Now you have to be careful sometimes with photographs. Some facilities will require consent, some facilities do not. Suspected witnesses, yes, yes. Mm-hmm. Mm-hmm. Okay. Births and deaths. Well, it skipped right over communicable diseases on the slide. So let me just mention AIDS, for example, is a reportable communicable disease in every single state. You have to report certain diseases when you acquire them. The health department likes to keep track of it, CDC, even the WHO, the World Health Organization, WHO, they really do keep track of communicable diseases. Births and deaths on page 347. All births and deaths are reportable by statute. That is for so many reasons, census reasons, um, record reasoning. Suspicious deaths are definitely something that needs to be looked at. Whether it's violent criminal activity, a medical examiner determines the cause of death. Oh, there's my communicable disease slide, just a little backwards. Adverse drug reactions, this is definitely reported, especially within the hospital systems, and I'm sure pharmacies do this too. They have to keep up with regulations. The FDA needs to know about it, and they share this information. Those commercials that we see, if you ever took Zantac and you're entitled to compensation, etc., it kind of goes back to this. If we continue to report drug reactions with a certain number, a certain population, they will have the right to sue the drug company. It's to improve the drugs, to change the chemical composition if we need to especially like cancer treatments. It's a practice of science and medicine when we're doing drugs, and if something works well to kill the cancer, but it also almost kills the patient, we need to tweak that. We need to fix that. So that's where these adverse drug reaction reporting it comes into play. Hospital acquired infections. This is a huge deal. Medicaid, Medicare will not pay a hospital bill if a patient acquires like a urinary tract infection or a blood infection while they are in the hospital. That's a big no-no. So all of these type of infections, anything hospital acquired, it could be the patient came in for a simple knee surgery and got a methicillin staph infection in their skin. If they got a urinary tract infection from having a catheter, that's hospital acquired. When the nurse put in the IV, if they get an infection at that spot, that is hospital acquired infections. All of those have to be reported for several reasons. Physician competency, that's discussed on page 348. National Practitioner Data Bank. There is a data bank created by Congress that keeps up with information as far as related to physicians' competence, conducts, adverse, um, any kind of adverse clinical privileges, etc. Incident reporting, that we're talking about that on page 350. Incident reports contain statements made by employees and physicians regarding deviation from acceptable patient care. So we do have our own self-reporting capability at my hospital, my healthcare facility. And the incident reporting is not like a legal accusation. It's, hey, this is what I saw. This is what XYZ was involved. And so then the internal healthcare facilities investigating team, if you will look into that. Because it goes back to that, if you see something, say something. State reportable incidents. Events include the reporting of communicable diseases, infections, unusual or unexpected cluster of patients with symptoms, disease exposure, suggestive of a health emergency or terrorism event. So you report those at the state level. Managers must be aware of the specific state reporting requirements, so also CEOs, administrators. And then page 351 to 352, the chapter ends with a very touching poem that a nurse would read the poem for each one of her nursing assistant students when she taught them, and it's just great to read. Read it, and yeah, okay. Please let me know if you have any questions about Chapter 17.